Mr. Chairman. So thank you for being here, Dr. Woodcock. Biologic drugs, complex products like enzymes and antibodies are great medical achievements that allow people to live longer, healthier lives. But these drugs are extremely expensive. According to IMS Health, biologics accounted for 28% of all drug spending in 2013, and we know that this number is rising. Medicare has also been hit hard. According to the GAO, just 8 biologic drugs, just 8 drugs account for over 40% of all Medicare Part B spending. Now, the good news is that the Affordable Care Act established a pathway for biosimilar drugs that, according to a RAND analysis, have the potential to save us about $44 billion over the next 10 years. But we know from our experience with ordinary generics that significant cost reductions for drugs don't occur until 2 or more follow-on competitors come to market. So in order to foster a robust biosimilars market that is actually going to drive down the cost of these drugs, drug makers need to know the rules of the road so they know whether to enter this market. So, Dr. Woodcock, it has now been 5 years since Congress authorized the biosimilars pathway, but so far the FDA hasn't even produced a draft guidance describing the standard for an interchangeable biosimilar. In addition, the FDA has not released guidance on how the products will be labeled and has not finalized many other guidance documents that will help companies enter the biosimilars market. So can you help us understand why the FDA has not completed this work in 5 years?
Well, we have a biosimilar program, and we have spent a lot of time. We have 57 products in development, and we have been giving those sponsors one-to-one advice. They are to 16 different reference-listed drugs, and so 57 products, 16 reference-listed drugs. You can see if these products get across the finish line, we will have competition.
Well, I appreciate that, but the question is, it's been 5 years now. In doing this, you know, the European Medicines Agency adopted a biosimilars pathway in 2003 and approved the first biosimilars in 2006 for the European Union. Health Canada approved its first biosimilars in 2009. The FDA is building on nearly a decade of experience with the European Union, experience from Canada, and yet 5 years have gone by and we still don't have any of these guidelines out, not even in draft form.
Well, we've issued 3 final guidances, and one of them is the foundational guidance for how you develop a biosimilar, which is the scientific considerations, and it put forth the scientific framework for what the companies needed to do to start. And because the statute rightly said that the comparison had to be to a U.S. reference-listed drug, many of these sponsors had to start by comparing to the U.S. drug, which might be different than the European reference-listed drug. We gave a scientific structure and a framework that said that the foundation is the analytical similarity, and that other types of studies were put on top of that, and the amount of clinical data needed depended on how much uncertainty remained about biosimilarity after doing that program. These 57 sponsors are engaged in the scientific program.
Now, I'm sorry, Dr. Woodcock. I appreciate that there is a process, and that's what I'm hearing you say over and over and over. The real question that I'm pushing on is it is time now to get this done. You know, the longer it takes you to set the rules, the longer that patients will be stuck with paying only one very expensive option to treat their medical needs. There aren't very many things in Washington that stakeholders on both sides of the aisle agree on, and that people out in industry agree on, but I think we all agree that it is time to get guidance documents. And if the chair will indulge me, I've got just a few seconds left, but I want to go back to this question about generics, if I can. Biosimilars can save an estimated $44 billion over the next 10 years, but that will happen only if patients have confidence in the quality of the biosimilars, and their doctors have confidence and will actually prescribe them. Now, we know from the very established generic drug market that it suffers from severe misperceptions here. Studies by researchers at Harvard found that nearly 23% of physicians had negative perceptions about the efficacy of generics, and nearly 50% had negative perceptions about quality. They also found that about 30% of patients felt that brand name drugs were going to be more effective than their generic consequences. Now, this is for something that's been around for a very, very long time. Given the newness and the complexity of biosimilar drugs, I'm concerned that misunderstandings about biosimilars could hamper their uptake in the market. So I understand that you're currently conducting research. You said you're starting to lay out a plan for how to deal with the public perception of biosimilars. But I just want to underline the urgency of this. Generics have been on the market for 30 years, since Hatch-Waxman opened up the generic market. And yet, even today, this is not a fully open market where physicians will prescribe and where patients have confidence in the drug. So I want to hear what it is that you're planning to do. If you could just give me something that's specific about dealing with the potential negative perceptions of biosimilars. We've got to create a market here that works.
Do I have time to answer?
Is that all right? Is that all right? Thank you. I appreciate the indulgence.
First of all, let me say we have to get the science right. So we can't have problems with the first biosimilars out of the block, or we will cause.
Totally understand that.
Okay,
that's why we need guidelines as well.
The guidances that you're talking about are about more policy issues. They are not about the scientific standards. We've issued 8 guidances. 3 final and 5 draft guidances.
I'm looking here at the documents that say a draft guidance for describing the standard for interchangeable biosimilars is not out.
That's correct.
So we've got to have those. And I get that you want to get those, but we also need a plan in place that's going to educate physicians, it's going to educate the public, because there really will be some confidence
Senator Warren,
that this will work. I have used my time. The chair has been most indulgent, so I will stop. Thank you, Mr. Chairman.